Okay, it's exactly 4:33. I think we have given another 3 minutes time for people to join in, and I'm sure they're going to join in. I think let's start the session. So, at the outset, good evening, everybody. My name is Dr.Rani Bhat, and I'm a gynae oncologist at Apollo Hospitals in Bangalore. Uh, January is a cervical cancer awareness month. So you know why have see each cancer has a particular month dedicated so that we can do more activities, talk about it, so that the public are aware of this cancer. So it doesn't mean that we have to just talk about cervical cancer only in January and forget everybody. I mean, forget for the another 11 months about cervical cancer. But importantly is that in January, we tend to have lots of sessions so that, this is very easily preventable cancer. But unfortunately, in India, we still see huge number of patients coming to us in an advanced stage. So we thought this is the best opportunity to have a basic meeting where we can have an interactive sessions. I just don't want to be a one-sided conversation. So what I would request everybody is that obviously when in a on a platform like this, it's going to be very difficult for me to address each and everybody because if the speaker is on, then we do not understand who is talking. So what I'll request you is, if at all you have any doubts, please put it in the chat box. At the end of the session, I'll surely answer those questions. Or if you still have any more questions, I'll also share my contact details. You can share it and I'll surely get back to you on that. So good evening, everybody, and welcome. And I should really tell you that all those people who have joined and all those people who will be joining us on this session, this gives us a great opportunity for us to learn about a vaccine which is available and which can prevent some cancers both in males and females. So since January is a cervical cancer awareness, I'll be talking a little more on the cervical cancer. But what I thought is that one of the main important factor for a lady to develop cervical cancer is by a simple virus. Now, with the COVID coming in, we have become very familiar about different kinds of viruses. So similarly, we have one virus called a human papillomavirus, which causes trouble in men and women. So as I said, human papillomavirus, if you see, it doesn't affect only women, but also it affects males. So if you see cervical cancer, literally we say more than 85% of cervical cancers are caused by this human papillomavirus. Again, oral cancer, both in males and females, 70% of them are caused by this virus. In males, penile cancer, 63% of them are caused by virus. Vaginal cancer in women, 75% caused by the virus. Vulval in a lady, 70% caused by the virus. Anal, both in males and females, 91% of them are caused due to human papilloma virus. So I just wanted to know, Jade Goody became very famous when Shilpa Shetty went for a Big Boss. So if you remember when Jade Goody came to India to participate in Shilpa Shetty's Big Boss, this was the scene what we saw, and that is where she got the news that Jade Goody was diagnosed with cervical cancer. So we always think that, cancer will not happen to us. Cancer can happen to anyone. It doesn't have any demarcation. So it can happen from young age to a senior lady. So imagine Jade Goody was just 27 years when she passed away due to cervical cancer. Now, of late, we do see that human papillomavirus related cancers is becoming an epidemic in men too. So if you see, Michael Douglas had oral cancer, and he did say that it was because of the sexually transmitted HPV virus, possibly because of the oral sex. That's what it says. So what I'm trying to tell is that human papillomavirus is affecting even males. So please do not think that today I'm here to talk only for women. I'm here to talk for both men and women. And yes, because it is January and we are talking about cervical cancer awareness, and this is the virus which causes cervical cancer, I'll be talking little more on cervical cancer today. So again, if you see, because when
married father of 3 Jason Mendelson felt a strange
HPV virus can affect males.
He got it checked out right away.
When I got diagnosed with stage 4 HPV-related oral cancer, my life stopped.
Jason has since recovered from his cancer and is determined to raise awareness.
So
about
HPV can affect men.
He's gotten his kids vaccinated and wants everyone to know it is preventable.
So imagine what it says. I mean, he got HPV-related oral cancer and he got his kids vaccinated because he wants to tell the world that this can be prevented with vaccine. So again, coming to, as I said, this simple virus literally causes about 6 cancers. So it's very, very important for us to know that human papillomavirus can cause cancer both in males and in females. Now, what is human papillomavirus? Human papillomavirus, it is simple like a virus, like how we have our COVID virus, the influenza virus, which we know causes cold and cough. So it is like any other virus. And in this group of viruses, we have about 200 or so kind of a thing. Like we do know, like the COVID virus, it transmits from person to person through air. So no wonder we've been wearing masks now. Okay, I have one more request. Please, everybody put off your mics off so that at least we can listen to what I'm talking about. So again, coming to this human papillomavirus, as I said, it's a simple virus, but this virus, it spreads from person to person through sexual intercourse. So that sexual intercourse, it could be through vaginal, anal, or oral sex. Now, this virus, we divide them into 2 types. One we call as a low risk, another one is a high risk. So when the name itself says it's a low risk viruses, they do not cause cancer, but they do cause warts. Now, I'm sure some people must have experienced this kind of a tiny cauliflower-like growth onto the external genitalia of both males and females. So these are called genital warts, which are caused by the human papillomavirus. Now, high risk, obviously, as the name says, high risk viruses are the ones which causes cancer for us. Now, again, as I said, human papillomavirus is a simple infection and a very, very common infection which is seen in a sexually active women and men. So it is said that once you've been sexually active, within months or years, that person can develop this human papillomavirus infection. Now, one of the common questions I get asked is that how do I get this infection? Because when women come to us and when we do this testing, and if the report says the HPV is present, they tend to worry, thinking that did husband cheat on them, or why is that I have got this virus? So let me just simply explain to you that this human papillomavirus is present both in males and females, mainly in the external genitalia. So it is there. As I said, it is there. So during sexual intercourse, one partner transmits the virus to the other partner. So say, for example, the wife has human papillomavirus A type and the husband has a B type. During sexual intercourse, A goes to the husband and B comes to the wife. So there is an interchange of this virus. So no wonder we say it is a sexually transmitted infection. Now, if you see, it is so common that we say 4 out of 5 women can be infected by this virus in their lifetime. Now, it is nothing for you to worry. You don't have to run to a doctor tomorrow and get yourself tested whether you have this virus. Why is that? Is this virus will be there in your body for some time. It will not cause any trouble. You will not have any symptoms. You will not have any cold. You will not have any cough. You will not have any fever. You will not have any itching at the external genitalia. Women will not have any white discharge. It will absolutely not cause any symptoms. So you really don't have to worry and watch out, like, do you have this virus? Now, why am I telling you don't worry is that because the body takes care of this virus. Now, if your immunity is really good, then your body fights against this virus and this virus goes away from your body. It is said that it can take up to 2 years for the virus to get out of the body system. Now, for some reason, the virus stays in the body for a long period of time, such as if somebody's immune system is low for whatever reason, then this virus can stay in the body for a long period of time. Or if somebody has a multiple sexual partners, so as I told you, each time they change a partner, they will get a new infection. And that infection stays in the body for some time and goes away, another partner, one more infection. So the body is exposed for this infection constantly. Now, those are the people who are at risk of developing cancer in the future. Now, again, coming to this human papilloma virus can cause in so many cancers. That is, if you see 90% of cervical cancer is caused by the HPV, 75% of vaginal, 70% of vulval, 63% of penile cancer in males. Anal cancer, if you see both males and females, it is caused by the human papilloma virus. Again, oropharynx. See, when we talk about oropharynx, to put it in a simple term, it is a head and neck. It is a head and neck cancer, what we are talking about. Both again in males and females, human papilloma virus is the culprit for us. So I want to stress again and again today that human papilloma virus causes cancers both in males and females. So if you see anus and the head and neck, both men and women are at risk of developing cancer because of this human papilloma virus. And external genitalia cancers both in males and females can be caused because of the human papilloma virus. Now, quickly, I will take you through the incidence. The literature is very, very limited in India, but there are few incidences like where the studies have shown like the cause of human papilloma virus causing cancer. So cervical cancer is the second most common cancer in India among women between 15 and 44 years. So as I said, you have seen Jade Goody, who was just 27 and died because of cervical cancer. And please do not think it will not happen to us. Every sexually active woman is at risk of developing cervical cancer. Now, other cancer, be it an endometrial cancer or a ovarian cancer or a breast cancer, these cancers, it could be a genetic factor or it could be an unknown factor. But here we do know sexually active women can develop a human papilloma viral infection and they can develop cervical cancer. So we know cervical cancer is caused by a human papilloma virus. And if you see right from 15 till 44, cervical cancer is the common cancer. And we notice that the peak comes between 45 and 70 years. So it can range anywhere from 15 and it can go up to 85. And believe me, in my practice, I have seen in a different varieties of women in a different age groups coming to us with cervical cancer. Now, again, human papilloma virus causing cervical cancer is more than 83%. Vulval cancer is generally not as common as a cervical cancer in women, but again, human papilloma virus in India, we have only one study. Please do not go by this study because this is the only one study what we had and they noticed about 30%. But worldwide, when we see 70% of vulval cancers are caused by the human papilloma virus. Vaginal cancer is again a important cancer for us because after cervical cancer, it is a vaginal cancer which is caused by a human papilloma virus. Again, if you see here, more than 70% is caused by the human papilloma virus. Anal cancer, as I said, both males and females are at risk of developing anal cancer, and more than 80% is caused by the human papilloma virus. This is a cancer, anal cancer. Human papilloma virus is the cause, and both men and women are at risk of developing this cancer. Now, coming to the head and neck. Head and neck, as I said, we are divided into 3 parts, but put it very simple. You just think about head and neck has 3 parts. One is oropharyngeal. Again, you see male and females are at risk. but somehow luckily women are little at a lower risk compared to males. So if you see males, they are really the incidence is really high in them in the head and neck. Again, if you look at the human papilloma virus in the head and neck, they say about 30% is caused by the virus. Oral cavity, both men and women are at risk. Men incidence is more than the women. Again, both in men and women, it is caused by the human papilloma virus in more than 70%. Coming to the third part is the larynx. Again, the head and neck cancers, male are more at risk developing than the females. Again, human papilloma virus is the cause. Now coming to the male cancers, the penile cancer, that is the penis, what we say the external genitalia of the men. Now this is not very common cancer. It is commonly seen between 50 and 70 years of age. And they see this again, the incidence is high in African, South American and Asian countries. Now HPV is detected in almost 63% of the penile cancer. So as I said, men are also at risk of developing cancer on their external genitalia, and this virus could be the culprit. Now, as I said, how is HPV transmitted? I told you it's a sexually transmitted disease. Now that could be by skin to skin contact, which could be a vaginal penile sex, penile anal sex, penile oral sex, vaginal oral sex, or use of sex toys which has been contaminated by the previous person who has used it. So again, let me please remind everybody that human papillomavirus can cause cancer both in males and females. So this is an important virus. It causes 6 cancers. So imagine one virus can cause 6 cancers, and both it doesn't spare men or women. And it doesn't look at what age, what nothing. So all of us are at risk of developing this cancer. Now coming to the, I've been stressing so much that this virus can cause cancer both in men and women. Now, most important question, and that is the reason why we are here today to know, is that can we prevent this HPV infection? See, when COVID came in, nobody knew about how to treat it. It didn't have any vaccines. Vaccines came in. The minute vaccines came in, everybody wanted to get the vaccine because, like, you know, the hype was so much that they thought if you get a vaccine, you are protected. But unfortunately, even today, we do not know that this human papilloma virus has a vaccine. Now, we do have this vaccine for many years, and it has proven that it is safe, and it is proven that yes, it can bring down cancers both in males and females. But yet, we do not see people coming forward because they are not aware of it. So how can we prevent this human papillomavirus infection? As I said, we do have a vaccine. Now, HPV vaccine provides a strong protection. Now, remember, strong protection against new infection. Now, what did I tell? During sexual intercourse, one virus goes from one partner to the other. So if somebody has been already sexually active and you take this vaccine, it will not take care of the virus which you already have, but it will prevent you from getting a new infection. So HPV vaccine, it will provide protection against new infection. Vaccination is prevention. As I said, it does not cure the infection which you already have. And let's say tomorrow, by some reason, you get a test done and your test says you have a HPV infection. Don't go asking doctor saying, doctor, I have a HPV infection. Please give me the vaccine. I think I'll get cured. So let me repeat myself. There is a vaccine known as a HPV vaccination. And this vaccine, if it is taken after you're sexually active, it will not take care of the virus which you already have, but it will prevent any new infection coming into your body. So that is the most important thing for you to understand. Now, who should get this vaccine? This vaccine is recommended both for boys and girls. Now, remember the slides and what I've spoken in the past. This virus causes cancer both in males and females. No wonder we are recommending that this vaccine should be taken by girls and boys. Now, what is the best age for us to give? We say you can start as early as 9 years. 9 to 12 is the best time to give this vaccine. Now, why is that? They have said 9 to 12 is that this is the stage where the immunity is developing, and when you give a vaccine, the antibodies what they develop during this time is the best. So no wonder we say from 9 to 12 is the best time for you to get your daughter or your son vaccinated. And the recommendation is that you can go up to 26 years. Now, let us talk about, you decide to get a vaccine tomorrow to your child. Now, how many doses do you have to get? When COVID came in, we said yes, first dose, second dose, and then we were not sure about the third dose. Then the third dose came in, and then we have the news saying that, you know, even if you take the third dose vaccine, the protection is only for 6 months. But believe me, in human papillomavirus vaccine, we have a strong evidence that these are the number of vaccines you have to take. That's it. We do not have any booster dose. So let's see, as I said, you decide to get your child vaccinated. How many doses of vaccine do you have to give? If you decide that if you're vaccinating your daughter or a son between the age of 9 and 14 years, you have to just give them 2 doses. So if your child is between 9 and 14 years, you have to just give them 2 doses of vaccine. So the first dose is day 0, and the second dose you can time anywhere between 6 to 12 months. So just 2 doses for those young people between the age of 9 and 14. Now, if your child is 15 and above, then we recommend 3 doses. That is 0, the day you get the vaccine. The second one should be 1 to 2 months from the day of the first vaccine. And the third dose is 6 months from the second vaccine. So let me again repeat it. If your child is less than 15 years, you just need to give them 2 doses. That is 0 and 6 to 12 months apart should be the second dose. If your child is more than 15 years, you need to give them 3 doses. So as I said, you can go up till age 26 years. But now the recommendation says even after 27, we can go up till 45. So literally, like, you know, from 9 till 45 years. But remember, the best time is this time when you give the young child who is between 9 and 14 years. Now, can the HPV vaccine be given to older age? Because when I was talking to my patients and my contacts that we are going to talk about on this chapter, I had a number of questions coming in saying, I'm 40 years old now, can I take the vaccine? Will it benefit? So as I said, after 27, yes, you can take until 45, but 3 doses you need. And the studies have shown that, like, you know, after between this 27 and 45 years, when you get the vaccine, yes, it will protect you. But I mean, the protection is not as good as like when you take when you are young. Now, obviously, if you want to get a vaccine and you are between 27 and 45 years, what I would say is just don't blindly go to a pharmacy, pick up a vaccine and go get yourself pricked. Go have a consultation with your doctor. Let the doctor assess you and see whether do you really would benefit by taking this vaccine, or would you just go for a screening. So if, say for example, yes, you have been recently divorced and you're planning to either have a partner or remarry again, yes, you are worried that you can be exposed to a new HPV virus, so you would want to take the vaccination. So there are situations like where it would benefit between 27 and 45 years. I would strongly recommend, if you want to, please go consult your doctor and under supervision, please take this vaccine. But the best time is to give when your child is between 9 and 15 years. Now, again, as I said, please do talk to your doctor. Please don't be a Google doctor. Don't just walk into a pharmacy, get the vaccine and get yourself pricked. If at all you're thinking, remember, after the 15 years, like how I said, it is 3 doses. Again, if you're between 27 and 45 years, it is going to be 3 doses. Now, how effective? Now, coming to, I said there are almost 6 cancers which is caused by the virus. And I'm very, very confident. And I'm telling you that we have a vaccine, and this vaccine will prevent this HPV virus. Now, I'm sure the next question everybody is going to have on their minds is like, how effective is it? We have a COVID vaccine. We don't even know how effective they are. Some studies say they're just effective for 6 months, 3 months. But how about this HPV vaccine? HPV vaccine works extremely well. As I said, HPV vaccine is been there since 2006. So it is just not new in the market. It has been there for so many years. It has been tested. It has been studied. And yes, we can confidently tell that HPV vaccine works extremely well. Now, if somebody has taken a HPV vaccine, we say the potential to prevent new infection is more than 90%. Now, since HPV vaccine, as I said, was first recommended in 2006, so there have been lots of studies, and since 2006, what literature has shown that people who have taken this vaccine, the risk of HPV-induced cancers have come down. And also, as I told you, the cauliflower growth, which is there on the external genitalia, sometimes even that incidence has come down. Now, this HPV-induced cancer and genital warts has dropped 88% in teenage girls and 81% among adult women. So imagine, like, we have this vaccine in 2006. Now, countries like Australia, they are telling they're on the verge of eradicating human papillomavirus. That's because of this vaccine. And every developed country, they are very, very punctual about taking this vaccine. But unfortunately, in India, we still lack that awareness. So people are not aware that we have this beautiful vaccine which can prevent us from these cancers, and hence we have not utilized it. So here I'm telling you that HPV virus is an important virus which causes 6 cancers. Both it can affect males and females. We've been having this vaccine since 2006. It has been studied very, very deeply. And we have so many studies which tells that, yes, it is safe, and it has been shown that pre-cancer, cancer, and the genital warts incidence comes down when you take this vaccine. Now, the protection provided by this vaccine lasts a long time. Now, again, as I said, when we are talking about the COVID vaccine, we do not know how long it stays. But since 2006, this vaccine has come into it and people have taken it. So far, they are having a very good antibodies. And so far, we are not recommending to have any booster dose. So that tells that the protection, what you have, if you take this vaccine at a correct time, then yes, the protection can last long. Let me again repeat, when I say if you have taken it at a correct time is if you have taken before being sexually active. HPV virus, as I again said, is a sexually transmitted virus. So if you take this vaccine before, or you give it your child before they are sexually active, that is the best time. And when you do that, the protection is really, really good. So again, who should not get? Yes, that's an important thing. Who should not get human papillomavirus vaccine? Like any other vaccines, yes, there are some criteria where you shouldn't give this vaccine to them. You please tell your doctor, if at all you're going for this vaccine, if you've had any severe allergies to any vaccine in the past, or you've taken a first dose and you have developed some severe allergy, please inform the doctor. Or if you're going for the vaccine, what we call as a Gardasil, it has yeast. So if at all you are sensitive to yeast, please, you need to inform. And obviously this vaccine is not given to women who are pregnant. Are there any side effects? I'm sure people who are there listening to me, everybody has taken their COVID vaccine. So what happened when you took your vaccine? Maximum you had pain at the site of injection. You had little bumpy feeling at the site of an injection. Next day you developed little bit of body pain. Some of them have developed fever. So similarly, this is also a vaccine for a virus. So you're going to have a mild side effects, exactly what I've mentioned: some pain, some swelling, some redness, some aches and pains, some tiredness. That is the side effects of the vaccine, what we generally see. Now, the rare side effects, somebody fainting, somebody having a severe reactions, are very, very rare, very rare. Now, coming to what types of vaccines. So you have heard me talking, yes, we do have a vaccine, and this is the best gift you can give to your child. And now the next question is, okay, which vaccine should I give my child? If I'm sure if you have done some Google research, we say there are two types of vaccines which came into the market. One is a Cervarix, another one is a Gardasil. Now, Cervarix covers only two types of viruses. That is number 16 and 18. 16 and 18 are the main culprits which causes cancer. So Cervarix covers only 16 and 18. As I said, this virus causes that cauliflower genital growth. Now, Cervarix doesn't cover that virus. So the best would be to go for Gardasil. Now, Gardasil has two types again. Gardasil, simple Gardasil, it protects against 4 viruses, the 2 viruses which causes cancer and the 2 viruses which causes the genital wart. So we had 2 vaccines so far. One is Cervarix and one is Gardasil. So I would always say, if a person is not sexually active, please go for Gardasil, because that will protect the person from the genital warts also. But now recently in India, Gardasil 9 has come in. As the name itself says, it covers 9 viruses, whereas here it was only 2, but here it has more coverage, and Gardasil 9 is the latest, and in US, it is just only Gardasil 9 now. So you want a Cervarix or you want a simple Gardasil, it's going to be difficult for you, because the protection what we get from Gardasil 9 is the best. So coming to which vaccine I should get, yes, it is Gardasil. Gardasil 9 has recently come into India. That was just launched September last year. So it may be a little difficult in some places to get Gardasil 9 vaccine. If you don't have, it is okay. Please go for at least the plain Gardasil. Now, coming to the million-dollar question, everybody asks me, and it amuses me, why do they ask this question, is what is the cost? So when I say, okay, we have this vaccine, the first question they ask is, Dr. Rani, what is the cost? Now, let me ask you something. You buy a fancy car, you buy a fancy phone, you buy a fancy computer, you don't look at the cost, but you look at like what are the latest technology your phone or your computer offers you. You know, you buy a car, you want the best features in the car, you want the maximum airbags, so that if at all there is an accident, you know you will be protected. But when it comes to health, please do not look at the cost. These are there to protect you. But anyway, let me tell you, the Gardasil vaccine, if at all you look into, now we have so many companies offering you a very, very decent prices, which the single dose can cost about 2,700. Now, as I said, Gardasil 9, I'll be very honest, I still do not know the exact figure of it, but once I know, I will surely share in all the platforms like where I've been talking today, what is the cost of Gardasil 9. So the cost, please remember, we are getting either 2 doses or 3 doses maximum. And look at the protection it is going to give you. The protection is going to be lifelong for you, and it's going to protect you from cancer. So please don't look at the cost of the vaccine. So if you fall into the category of where you can get that vaccine and benefit, or you want to vaccinate your child, don't look at the cost factor. I'm sincerely requesting you, please get this vaccine, both for your boys and girls. That is the best gift any parent can give their child. Now, coming to, as I said, can we prevent HPV infection? I said, yes, we can prevent it by this HPV vaccine. And we have seen, like, who has to take it, how many doses they have to take it, what are the contraindications, and what are the side effects. Now, coming to the next one, how can we prevent is awareness. Now, you have learned so much about this virus today. Please go and share this information with your friends and family members. Awareness is the first step. Awareness is the first step. As I said, it is a sexually transmitted disease. When it is a sexually transmitted, please practice safe sex. That is the most important. And it has shown that if you're using a proper condom, you can decrease the risk of infection 70%. But those people who are into sexual relationship, let me remind you, if you just wear a simple condom, you are not fully protected from getting this infection. Your protection is only 70%. So be very careful, have limited number of sexual partners, and as I said, be aware how you can prevent it, and please do go get this vaccine. Now, how do you cope? See, for example, you've got some tests done. Women, when we do pap smear, we do say, you're HPV positive or negative. If at all you're positive, how are you going to cope with that? As I said, there is no treatment for this. Absolutely. So many patients, they ask me, Dr. Rani, is there any medications for me to get rid of this infection? Should I use some vaginal wash? Please do not use vaginal wash. Don't do anything. If your body immunity is good, then it takes care of the virus. But again, as I said, you need to communicate with your doctor. Most important is quit smoking. Now, smoking, what happens is it generally brings down your immunity. So when your immunity is low, this virus stays in the body for a long time, and this virus can cause trouble. So if you are in the habit of smoking, please take some advice, take some help, and quit smoking. And remember, you're not alone. Like I said, 4 out of 5 women can have this virus in their lifetime. So it is just not you. Don't blame yourself. How did I get this virus? Was it this boyfriend of mine who has given it? Don't be suspicious. Don't be angry at yourself. This is a very, very common virus, common infection. You need to talk openly, talk with your friends in the same group. Like, the problem in India is that we do not talk. We are not open, especially when we talk about such topics. It is a hush hush thing. So let's spread this awareness. The most important thing is we need to spread this awareness. It is a very, very common infection, and we can easily prevent it. Now, coming to the most important topic of my today is I'm talking about a cervical cancer, because we are in January. Previously, cervical cancer was the common cancer in women, but now cervical cancer has become a second common. That doesn't mean that we have less number of cases. What it means that the breast cancer cases went up so much. So the breast has become first and the cervix has become second. Again, as I said, it is easily preventable. Where is the cervix? The tip of your womb, which opens up at the time of menstruation or at the time of delivery, that is called cervix. So if somebody develops a cancer there, that is known as a cervical cancer. If you look at the incidence, India is really, really high. So we do have high incidence of cervical cancer. Now, who gets cervical cancer? As I said, the most important thing is this human papillomavirus, which causes trouble. Now, if somebody has started sexual intercourse at an early age, they have multiple sexual partners. If somebody has a habit of smoking, or they've used birth control pills for more than 5 years continuously without giving a gap, having given birth for more than 3 children. Now, what happens is that during childbirth, there can be some trauma to the cervix. And during the healing process, the virus can stay in the body for a long period of time. If somebody has other sexually transmitted disease like herpes or HIV, then obviously these are all friends. So they get along and the HPV also comes in. Now, for whatever reason, your immune system is weak, either you've had a kidney transplant and you're on medication suppressing your immunity, or somebody is HIV positive, their immunity is low. For whatever reason, if your immunity is low, then this virus can stay in the body for a long period of time and can cause cancer. So again, as I said, yes, please get vaccinated. And for women, very, very importantly, you need to get regularly your pap smear test done. So I will go in detail about pap smear test. Stop smoking and limit your exposure by limiting number of sexual partners. So when is the best time to go for a pap smear? Okay, before you go for a pap smear test, let's say you've not had a pap smear test so far and you want to go. When should you go first? When is the best time to go? What we generally say is that 3 years after being sexually active. Okay. Western guidelines, they give us a guideline saying like if a lady is 25 years, after that they should go. But what we generally tell is, yes, in India, somebody may not be sexually active, not married till age of 30. Do they have to go? No, they don't have to go. So to put it very simple, 3 years after being sexually active, you have to go for your first test. Okay, so 3 years after being sexually active, you have to go for your first test. Now, before going for your pap smear test, there are a few things which you need to understand. 2 days before you go for your test, do not put anything in your vagina. Now, what do I mean by do not put anything into vagina is that for some reason, if your doctor has given you some medication because you have a white discharge, some medicine to be put into the vagina, that's what, if you're doing that, no, you can't go for your pap smear test. Again, if you have the habit of going for a vaginal wash, there are so many washes, and I hear young women telling me that they regularly do this vaginal washes. Please do not do that, because vagina has some organisms which are supposed to be there. Don't wash it away. So even we say do not have sexual intercourse for 48 hours before you come for the test. So that's what I say, do not put anything into the vagina, be it medication or be it a vaginal wash. No sexual intercourse for 2 days before you come for the test. Now, all these things, they can change the test results because they may wash away the abnormal cells, and even if you have a test, the report may not be very accurate. So the best time for you to go for the test is anywhere between 10th and 20th day of your menstrual period. Obviously, don't go during your menstruation because this test is taken from the cervix, and when you're menstruating, there is only blood there. So anywhere between 10th and 20th day of your menstrual cycle, you can go for this. And 48 hours, please remember, no sexual intercourse, no putting any medications in the vagina. Now, most women, they ask is, does it hurt? Now, believe me, when you're talking to a lady gynecologist who has gone through having their pap smear test done, they know firsthand experience how it is. To be very, very honest, it is not painful. Yes, it is, little discomfort will be there. So what I generally do is I explain to my patient each and every step, what am I doing? And I kind of like distract them, talking to them, gossiping with them about their favorite topics. By doing so, they tend to relax. If not, what happens? They tend to hold the pelvic muscles very tight, and that's when it's going to hurt them. So one simple step, what I want you to remember when you're going for your pap smear test is, when you're lying on that couch, just concentrate on your breathing. It's very easy for somebody to tell, please relax. You know something is going into your vagina, and reflex, your muscles will go into spasm. So the best thing is just concentrate on your breathing. Deep breathing, just concentrate. It is just 2 minutes job. That's it. Now, after vaccination, should I still go for your pap smear test? Now, I've told, yes, please take vaccine. It is really good. And the next question is like, okay, I have taken my vaccine already. So why the hell should I go for my pap smear test? But please remember, yes, you have to go for your pap smear test, because the pap smear protection, as I said, it can give up to 80 to 90%, but not 100%. So there can be small group of women who may be still at risk. So it is important that, yes, cervical cancer can be prevented. You have to go for your regular screening even after you're taken your vaccine. Now, let me end it. These are my contact details. This is my website where I have put it in a very simple words about the various diseases and about the pap smear and the cervical cancer. I'm there on the Facebook and also Instagram. I keep posting the health educational parts. If there's any way that you want to communicate with me, either on the Facebook or onto the Instagram chat, yes, you can. So before I end it, let me tell you that human papillomavirus causes cancer both in males and females. Sexually active people, you cannot escape this virus. You can never escape this virus. Even if you have a single partner, you're taken best precautions, you can never escape this virus. So as I said, we do have a vaccine for this. The best time to take this vaccine is when the child is between 9 and 15 years. If your child is between 9 and 15 years, you just need only 2 doses of vaccine. After 15 years, yes, you need 3 doses of vaccine. You can go up till 45 years, but what we say is between 27 and 45. If you really want to take, please sit with your doctor, talk to them and see whether will you really benefit. So the first way of preventing these cancers is by taking vaccine. Now for women, cervical cancer, of all the cancers what I have spoken, cervical cancer is the first cancer, and we know literally, virtually all of the cervical cancers are caused by this virus. So no wonder we say women should go for regular pap smear test. Even if you're taken the vaccine, you have to go for your pap smear test. 3 years after being sexually active, you need to go for your first pap smear test. If you're less than 30 years, we do a single test known as a pap smear test. After 30, then we generally do a combined test, that is a pap smear and also HPV test. So that is a combined test. If you do that combined test, you may have to repeat your pap smear after 5 years. Keep doing this until you are 65. Remember, your first pap smear test is going to start 3 years after being sexually active, and it goes up till 65 years. Even if you've taken your vaccine, even if you've been doing regular pap smears in the past, doesn't mean that you can stop in between. Please remember, whatever precautions we take, whatever vaccines we take, it is not 100% protection. And if you go for your regular pap smear test, we can identify you even before you can turn into cancer. So that is the best time we can pick up people and treat them. So remember, please, regularly you have to go for your pap smear testing until we are 65. Those women who had a surgery, had a hysterectomy, the uterus and the cervix is out, should they still do? If you've been regularly doing your pap smear test and all have been normal in the past, and the final report of your surgery also tells there's nothing to worry about, then you can stop going for your pap smear. But if you have not done any pap smear test regularly in the past, then what I advise you is you still go for the pap smear. Now what we do is we take from the vagina. So remember, the virus causes cervical and the vaginal cancer also. So we want to see whether the virus is still there in the vagina. So if somebody's had hysterectomy, sit with your doctor, discuss with them whether you still need to have a pap smear test done. So the most important way of preventing this virus and preventing those cancers is by awareness. So please share this information with your friends and family members. And a request to all those parents is that please get your child vaccinated. This is the best gift you can give your child. As I said, this vaccine has been there since 2006. It has been tested various countries, and it has been proven beneficial and safe. And believe me, that's the best gift you can give your child. And yes, if you want to take for yourself, you can take until age of 45, but please go to a doctor, discuss with them, and only then I would want you to take that. So if at all there are any questions, quickly if you can put it in the chat box, or I think if we are okay, I'm not very sure whether we'll be able to take questions directly. We can try. If people who are out there, like, if you want to ask, you can unmute yourself and ask a question. But let's try that. If that doesn't work, then I think we'll just go to the chat box and you can put your questions there. Okay, in the meantime, what I'll do is I'll quickly read about the questions what we have in the chat box. If one has already taken Cervarix injection, should we take Gardasil 9? Okay, that's obviously, like, when I'm stressing now so much about Gardasil night, that is, you get worried like, okay, fine, have I taken a wrong one? No, because see, as I said, there are lots of viruses. Now, Cervarix covers two kinds of main important virus, but there is a cross protection to other viruses. So if you have completed your Cervarix schedule, no, you don't have to change. Don't go to Gardasil. You're happy, your protection is good, please, but go for a regular pap smear test. So that would be it. How often should I have a pap test? I think I covered that. I will repeat again myself. Your first pap smear test should be 3 years after being sexually active. And if there are two ways of doing it, some centers do only pap smear test. If you're doing only pap smear test, then we say every 3 years you will have to do. If you're doing a combined test like a pap smear and a HPV test, then what we generally say is that you can do it once in 5 years. So it depends upon the kind of test what you have got it done. If it is a simple pap smear test, once in 3 years. If it is a pap smear and a HPV test, then once in 5 years. Okay, thank you, ma'am. This is a really great knowledge of this cancer. Good talk. Thank you for that. Okay, is it safe to have sex after being vaccinated? Oh, yes, absolutely, it is safe. Now, this vaccine, what we take, okay, it just builds up the immunity. So it doesn't, I mean, it will not cause any harm to you. So it is absolutely safe to have sex even after vaccine. Is there any test for males to check HPV? Okay, that's a brilliant question. Now, I've been talking about, like, so far, whenever I've been talking only for women. But today, I felt like when I know that this virus can cause cancer even in men, I thought it is my duty and responsibility that I need to educate men too. Now, luckily for women, we have a simple test as a pap smear test and the HPV test where we look, do they have HPV or no? Unfortunately for males, we do not have any tests so far. Now, there are no tests to see in the external genitalia if somebody is having HPV virus, or in the oral, do they have HPV virus? There are no tests done, unfortunately. Now, why is that? Is that the way the virus behaves and where it stays, it is very difficult for them to come up with the testing. So generally, if at all, say, for example, you have some cauliflower like kind of a growth onto your external genitalia, then yes, doctor may advise saying, let's go and get you tested whether you have this virus. If not, like how screening we do for women, we do not have screening tests for males to check for the HPV virus. Let's hope in the future as we do come up with some tests even for males. Can we give vaccine for male child in our clinic? Okay. Now, I'm sure that question is coming from a medical person. Yes, the vaccine can be given in any center, in a clinic. Obviously, we do know that, whenever we are giving any vaccine, be to a child or be to an adult, we need to have all the facilities available, because there can be a very, very rare episodes of, like, having a major side effects like having an anaphylactic. So if at all you have all those setups, you've been vaccinating a young child, be it for polio or be it for BCG or be it for rubella or anything, yes, you can happily vaccinate boys in your clinic. Thank you, ma'am. Okay, thank you so much for that. What about after the age of 45? Okay, now we don't have to be kind of like depressed saying, oh, I'm more than 45 and unfortunately I've missed the bus. And what will happen to me now? So as I said, see, the virus is already there. It is what I would advise is that just ensure that you have good immunity. Thanks to this COVID situation, we have different recipes to boost our immunity. So be it like, the food what we are taking, bring down the stress levels. If possible, it is very easy to say, because your job is too stressful. You can't just quit the job and sit at home, isn't it? But have some hobbies, like, so that your stress levels comes down. Have a balanced diet. Be careful about like what you eat. That's very, very important, because what you eat what goes in is the one which builds you a good immunity. So if your immunity is really good, it fights away the virus. It doesn't fight away only the HPV virus, it fights away the COVID virus too. So after 45, I generally say, especially women, go for your pap smear test screening, and both men and women ensure that you have good immunity. Okay, ma'am, is this vaccination can be taken before getting married, or it should be after getting married? Oh, please, let me tell you again. I'm telling you the best time to get this vaccine is before being married, either before being married or before being sexually active. So that is what I'm trying to tell here. The best time is before being married or sexually active, because you've not got the virus so far. So if you take the vaccine, you will have good antibodies, and that will prevent the virus to come in when you're sexually active. So the best time is before you're sexually active, dear. There are so many vaccines given to children. Is this vaccine not part of that? No, unfortunately. See, as I said, 2006, I was lucky to be in Australia for about 3 months, and we did a study of this HPV virus in those women before vaccination came in and after vaccination came in. And for every school going boy and girl has to get this vaccine, and it is free for them. You know, till 20 years in Australia, the vaccine is free. After 20 years, yes, if you have skipped it, then obviously you have to pay some nominal money. But unfortunately, in India, this vaccine has not come under the national vaccination schedule so far. So unfortunately, it is not there. You have to go specifically ask your pediatrician that you want your child to have this HPV vaccine. Should the partner be vaccinated if either one is detected with HPV? Now, okay, for example, let's say wife is detected with HPV virus. Should the husband take it? Now, as I said, see, you are taking HPV vaccine to prevent new infections. If at all, say, for example, if wife has the virus, husband may be having the virus. So if you take a vaccine, it is not going to take care of the virus which you already have, but it is going to prevent further new virus coming into your body. So yes, it is okay if your partner has a HPV infection detected. No issues. Your partner also can take it, and you also can take the vaccine. How many doses of vaccine recommended for boys and men? So the vaccine schedule is the same. Boys and girls, it is the same. Boys and girls less than 15 years, it is 2 doses. After 15 years, it is 3 doses. There is no sexual discrimination here. Boys and girls, they get the same doses of vaccine. Only difference is the age. If it is less than 15 years, you just get them 2 doses. If it is after 15, then you give them 3 doses. Okay, I think I have kind of like covered almost all the questions here. Now, if you have any more questions, you can type in there, or if you want to have an interactive sessions, maybe you can unmute yourself and ask me a question, or you're feeling shy to ask, be it in the chat or talk to me now. I would say I shared my contact details. You can be in touch. Okay, there's one more question. Should we go for any investigation? Oh, that's a fantastic question. Should we go for any investigation before going for vaccine? That's fantastic. Sorry, I didn't cover that point. Okay, fine. You decided, yes, I want to go for this vaccine. Okay, don't do any tests. Nothing. You do not have to do any test. No blood test, no urine test, nothing. You just go consult your doctor. Let your doctor take your history, make sure that you do not have any allergies, and you can take the vaccine. As I said, we do not need any test to check whether do we have any virus in our body or no. You don't have to do that. Just go and get yourself vaccinated. No investigations required. Okay, I think, oh, we are within the time frame. It was 4:30 to 5:30, it's 5:32. So, okay, so if there are no questions, I'll again repeat that, Human papillomavirus is a sexually transmitted infection. Every sexually active males and females will develop this infection. It can cause cervical cancer, vaginal cancer, vulval cancer in females, penile cancer in males. It can cause head and neck cancer both in males and females. It can cause anal cancer both in males and females. So as I said, it can start right from age of 15 years, can go up till 80. And it can happen to anyone. It can happen to people staying in metros or people staying in village. Anyone can develop this virus and can develop cancer because of this virus. How can we prevent it? Awareness. Please go share this knowledge with your friends and family members. We have a vaccine for this virus. The best time to give this is when the child is 9 to 12 years. The best time is less than 15. If you do that, you have to just give them 2 doses. After 15 years, you have to give them 3 doses. So after 26, between 27 and 45, we do say, yes, it can have protection, but not as good as like when you take when you are young. But no harm in taking, and you don't have to do any tests. Nothing is required. Only thing, please talk to your doctor. Ensure that you're not allergic to any components of the vaccine. And make sure you do not have any diseases, the immunocompromised conditions, even when you're taking vaccine. And the simple side effects, like any other vaccine, you're going to have just a minor side effects. And for those women, please remember, even after you've taken the vaccine, you have to go for your regular pap smear test. Okay, I think, okay, thank you very much, doctor. The session was very informative. Okay, thank you so much for that feedback. As I said, if I was able to convey the simple message that human papillomavirus can affect both males and females, we all are at risk of developing this virus. There are ways of preventing it. So please share this knowledge. It is very, very important that we share this knowledge, because that is the first method of prevention. Second, we have vaccination, and women should go for regular pap smear test. Okay, I think now people are just thanking us for the informative sessions. It was really, really nice and great opportunity to interact with you all. Fantastic questions. That shows that, like, everybody's been active, and I hope I have conveyed the most important information. January is a cervical cancer awareness month, but let us just not stop being aware about it only till tomorrow, and then we forget a bit about from 1st of February. This cancer can be easily prevented. Believe me, in my clinic, when I see patients coming to us with cervical cancer, advanced stages, where it has gone, eaten up into all the tissues, you feel really sad, because this cancer could have been easily preventable. And most of them, they tell me, doctor, I didn't know about it. If I had known. So, please spread this news, and don't think about the cost of the vaccination. This one-time vaccine, what we get, it gives you a lifetime protection. And imagine you have a vaccine against cancer. It is proven since 2006, we've been having this, and it has been proven that incidence really, really comes down. So don't ignore this knowledge, what you have acquired today. It's my sincere request to everybody, share this knowledge. Vaccinate your children. If you want to get vaccinated, please get vaccinated. If you have senior women in the family, advise them to go for the regular pap smear test. Okay, I think we have one more question here. Okay, it's just a comment. I shall share your knowledge and refer to all others. Get in touch with you for reference. So I'll be very happy. That's the reason. As I said, I'm there on Facebook, I'm there on Instagram, and my website. Three modes you can get in touch with me. Any question, any silly question you have, do write to me. Yes, I may not be able to respond to you immediately because I'm a surgeon, but whenever possible, I will surely get back to you. That is one promise I always do to my patients, is that I will get back to you. There may be little delay, but I will surely get back to you. So, thank you so much. It will be very kind of you if you can go share this knowledge with your friends and family. Again, as I said, don't stop this cervical cancer awareness just with January, because January is cervical cancer awareness. We also have vaginal cancer for a different month. We have a vulval cancer for another month. We have penile cancer for another month. We have head and neck cancer another month. And we have anal cancer. So, there are lots of months which will be coming, and you may hear some speakers talk about it. But remember, human papillomavirus is one of the main culprits for all this cancer, and there is a way to prevent it. So just don't stop with January. Please be positive. I know during COVID situation, most of them have gone through a very, very stressful period. That itself can bring down your immunity. Because of that, most of them have got COVID infections. And try your best to be positive, have a healthy diet, maintain a good balanced diet, because a good balanced diet is one mode of building up your immunity. And the second one, which I have personally seen and experienced, is that with exercise. So some form of exercise is really, really good for your health. I'm not talking about having a good figure or something, but good exercise builds up your immunity. Good diet, exercise, and de-stress yourself, have some hobbies. And very importantly, do not forget what I have taught you today. So you do everything, and if you forget what I have taught you today, then that defeats the purpose. Okay, so we need to do everything together. If you do everything together, then I can assure you that you will be hale and healthy. And always try to remain positive despite of the COVID situation or what situation we are in. The phase is going to end. There's always a silver lining, and if a day has to end, a new day will begin. So be positive. That builds your immunity. That's very, very, very important. When I have a patient who comes to me with cancer, I try my best to build their positivity. It is very easy for somebody to say, but a person, when they're going through cancer, it is very, very difficult. But I've seen those women who've been so positive, who just say, no, I'm going to fight it. The success is so good in them. So we have seen clinically. So please be positive, improve your immunity, and share this knowledge, and get yourself vaccinated. Go for your regular pap smear. So I think there are no more questions. So if there are no more questions, I think maybe we can say bye, go have a nice cup of coffee, sit with our family members, chat with them, and share our knowledge, what we have today. And if you have not had screening or a vaccination coming days, just have an appointment with your doctor. If you have any doubts, I always tell, seek a second opinion. No harm in getting a second opinion. Or you want to get in touch with me, I'll be very happy to guide you and help you out. So that's it from us, from Apollo Hospitals, Bangalore. Thank you so much, everybody, for joining us on this lovely Sunday evening. It was a great evening, sharing my knowledge with you, and lovely questions. So be positive, and very soon I think we'll come up with some more talks like this, easy ways, how we can prevent cancers, because the minute somebody hears the word cancer, they just want to go away. Everybody thinks, no, it will not happen to me. But please don't do that. It can happen to anybody. We have seen COVID can hit anyone. Similarly, the HPV virus can hit anyone. Anybody can develop this disease. So don't tell yourself, you'll be cheating yourself by doing that. Don't do that. So please be careful. COVID is still going on. Maintain distance, be safe, wear your mask until we know, yes, the pandemic is over. So lovely to be with you all on a lovely Sunday evening. Thank you so much once again. And from Apollo Hospitals, I thank everybody. And if there are any more questions, please do share on our platforms and I will be answering them to you. Okay. Okay then. Take care. Bye-bye.